On this week's episode of Dr. Marla and Friends, what should you do if your baby's first words don't come as quickly as you'd like? We have information every parent needs to hear. And if you suffer from migraine pain, Dr. Jonathan Gladstone will help ease that pain. Also, can significantly cutting your caloric intake 1 or 2 days a week help you lose weight? Our expert panel is here to debate the pros and cons of intermittent fasting. Parents are always worried about when their child should start talking. The truth is that every baby is different. Some will say their first word around 5 months, while others won't start talking until much, much later. So what are you supposed to do if your child isn't talking? Well, here's some sound advice from a pair of experts.
All right, the first thing we're gonna do is read a book. That's right, it's our Mr. Gumpy book.
As a parent, you have a feel for your child and you sort of know how you're interacting with them, and you sort of get a sense of where they're at, and you watch other kids and other parents interact, and you're always comparing, and that's not really very good. But there's also a baseline of, you know, where do we fit in the pool of normal? And so we sort of saw that other kids were having conversations with their parents, and we weren't really having those same conversations with ours, and thought, well, we're probably getting to the age where that should be the case. So let's start investigating maybe why or how we can get help.
Many kids have speech and language delay. It's actually one of the most commonest problems that we see in our clinics or offices. And of those kids with the language delay, 1 in 10 kids will actually need structured language support in order to develop their normal speech and language skills. Most parents start to become concerned between 12 and 18 months of age, when their child isn't talking as much as their peers. By 2, children should be putting 2 words together, and if they're not meeting those milestones, then it's a concern and they should come and talk to their doctor.
Speech is one of those really important things. If they can't express themselves, they run into all kinds of problems later in school, later in life, and there are all kinds of signs that say that the earlier that we can catch these things and help them, the less of an issue anything is later.
The first step, if parents are concerned, is to go and see their doctor. The doctor will take a history and observe the child and see whether they're meeting their language milestones, and they'll also look at their overall development to see that other areas are on track. If it looks like it is just a language delay, the first thing to do is to do a hearing test. The next step is for parents to contact the province's preschool speech and language program. This is a program that's funded by the government and is free for children from birth until school age. Once their name comes up on the wait list, they'll meet with a speech and language pathologist.
In we go.
That pathologist at the assessment will observe their child and look at their child's skills and see whether or not therapy or intervention is necessary.
As a pediatric speech-language pathologist at the hospital, I'm called in by a lot of the pediatricians when there's concerns about speech development, language development, or other developmental delays. So this may be a problem with pronunciation, with kids not using enough words, maybe they're not understanding like their peers, they may be stuttering, and there may be some concerns with some other developmental disorders like autism or something else. And the pediatricians really need information for me to make an accurate diagnosis. So that's how it really starts, is with a good, thorough assessment. And then the follow-up is usually some treatment, which could be as an individual session, so one-on-one with me and the parents, or in a small group, which tends to be the more effective type of therapy because kids are learning then how to interact with each other as opposed to with just me or just with their parents.
Early intervention is critical. We know from so many studies and research projects that the earlier children get support and intervention, the better the outcome.
Typically in a language-based therapy session in a group, we usually have the kids greet each other. So we're practicing saying hi and how are you and practicing their names. And then we usually review the group rules. The rules are, Kaylee, listen close. The rules are when Joseph's talking, you are listening, right? And Joseph, when Kaylee's talking, you are listening, right? Yeah. And then we go through a series of activities, and each activity looks like we're just playing or it looks like we're just reading a book, but there's really a lot more to it that we're working on. Who wants a picture?
This one.
You want this one? You can say, I want a picture.
Yeah, I.
And how about you, Joseph? Do you want a picture too?
This one.
Okay, you can have this one. This one's for you. Activities like crafts are really common in speech therapy because there are pieces that they need that they don't have, and I have them. So in order for them to get them from me, they have to use their communication skills to get them. There you are, nice. Today I did a lot of waiting for them to ask for the glue and to ask for different pieces and to encourage them to expand their vocabulary beyond, can I have a picture, but to a certain type of clothing. So we usually use things like crafts or other activities that kids really like because it motivates them to communicate and it sort of forces them to communicate, but it's still fun. Squeeze.
I need help.
You need help. Okay, where should I put it?
On the clothesline.
On the clothesline. Squeeze.
We're seeing changes and improvements, and that's what we wanted. So, you know, just sort of like everything else, the more you do it, the more you practice, and that's what we want as parents for our kids.
A lot of parents will often think that their child's language will just come along, when really, in fact, if they get therapy, they can make much faster gains, and that allows the child to become much more confident around their peers and really helps to improve the family dynamic.
What do we have? We have a
Hat.
and a
Box.
and
A
man. That's right. I definitely see changes in the kids week to week. Parents are telling me all the time that their kids are doing better in school and they're making friends, and that's what this really is all about.
Coming up on Dr. Marla and